So, your patient's heart has stopped.
In this video, I'm going to go through some common causes of your patient's heart stopping, and I'm going to give you some tips and tricks and a brief overview of them. Please like and share this video and follow for more if you found this video helpful. The 4Hs and 4Ts is a common memory aid that we use to remember the cause of the heart not pumping blood effectively. The 4Hs are as follows: hypoxia, hypovolemia, hypo or hyperkalemia or other electrolytes, and hypothermia. I remember them as solid liquid gas and temperature. The 4Ts are as follows: tension pneumothorax, tamponade, thrombosis, and toxins. And I remember this by drawing a T across my chest. People often remember thrombosis as pulmonary embolism, but please do not forget that this could also indicate thrombosis within the coronary arteries, i.e. a myocardial infarction or heart attack. Cardiac tamponade is a diagnosis that you consider if a patient has an indicative history, for example, a recent heart surgery or recent chest trauma, and is confirmed using a bedside heart ultrasound. Now, I want you to pay attention to whether the patient is presenting with a shockable or non-shockable rhythm, as this can give you clues to the cause. Shockable rhythms are normally caused by myocardial infarctions, i.e. heart attacks, or dangerous electrolyte imbalances such as hyperkalemia. And non-shockable rhythms are typically caused by hypovolemia, hypoxia, cardiac tamponade, and tension pneumothorax. Now, these are common associations, but not a hard and fast rule, and you still have to consider all the other reversible causes. But the rhythm might give you some clues. Prolonged CPR, i.e. CPR that might go on for more than 40 to 45 minutes, might be indicated in certain cases. These indications include pulmonary embolism, toxins, and hypothermia. In cases of prolonged CPR, you need to consider whether you should move your patient to a place that can best provide this. This can be places such as A&E resus or anesthetic theatres. However, if you think that the risk of moving the patient outweighs the risk of staying in the same area, then you should consider asking someone to bring an automatic CPR device, such as the Lucas or the Autopulse. These are devices that you can fit on the patient that can provide CPR automatically. This will ensure that the patient will get good quality compressions throughout the prolonged period of CPR. This information has helped me and my patients in the past, and I hope will help you and your patients in the future. I hope that helps.